Are hair transplants permanent? Most top-ranking articles on Google claim that hair transplants are indeed permanent. On the other hand, we have no shortage of well-known balding celebrities who have had hair transplants only to then lose their transplanted hair. In this video, I'm going to show you how and why most times transplanted hairs do indeed continue to miniaturize or become thinner and thinner, and what you can do to avoid this. First of all, to cover this quickly, what is a hair transplant? Hair transplants are essentially taking hair follicles from one part of the body, usually the back of the head, which is called the donor site, and placing them where hair is thinner and sparser, which is usually the top of the scalp, and this is known as the recipient site. So on a high level, hair transplants are essentially rearranging your hair in a way that makes it look more aesthetic. There are different types of hair transplant techniques, and these procedures have improved and changed a lot over the last few decades. So whereas hair transplants used to look very obvious, they are now pretty good if conducted by a skilled surgeon. To determine whether hair transplants are permanent, you need to know about the donor dominance versus recipient dominance or recipient site influence debate. For many decades now, when it comes to male pattern baldness, there has been a debate around why hair thins around the top of the scalp but remains intact around the sides and back of the head. On one side of the debate, some people claim that this is because hair follicles on the upper scalp are genetically sensitive to androgens like DHT and therefore predisposed to thinning, whereas hair follicles on the sides and back have a different genetic makeup and make them more resilient against androgen hormones and therefore immune to thinning. This theory is known as donor dominance. On the other side of the debate, other researchers claim that hair follicles are pretty much the same all over the scalp, but the reason hair tends to become thin around the top is because of certain differences in the scalp tissue immediately surrounding the hair follicle. Differences in vascularity, dermal thickness, skin tension, or inflammation in the top part of the scalp can result in an environment that is more hostile to growth, therefore leading to thinning over time. This theory became known as recipient dominance or recipient site influence. So which is it, donor dominance or recipient site influence? Back in 1959, Dr. Norman Ohrenreich was determined to find out which of these two schools of thought was right by conducting a hair transplant on 52 balding men. Specifically, Dr. Ohrenreich transplanted hair grafts from the back of the scalp to the top and also transplanted skin from the top to the back. After 2.5 years, Dr. Ohrenreich followed up with the patients and observed that hair grafts transplanted from the back of the head to the top of the head continued to grow normally. Furthermore, grafts transplanted from the top of the head to the back of the head did not grow any new hair. Therefore, Dr. Ohrenreich concluded that donor dominance was the correct argument, and this suggests that hair transplants do indeed last a lifetime. But if donor dominance is correct, why have people like Joe Rogan gone bald despite having had hair transplants? And why is it that this patient questionnaire study on men who had hair transplants resulted in only 60% of patients saying that they had no loss of hair from the transplanted sites? To answer this question, let's look at how hair thinning actually progresses. Each hair follicle goes through a cycle of growth, rest, and shedding, at which point the hair follicle regenerates and the cycle starts over. This is why some light shedding is actually completely normal. Pattern baldness progresses through hair follicle miniaturization. This is where each time the hair follicle regenerates at the start of the hair cycle, the hair strand produced is thinner than in the previous cycle. In pattern baldness, hair thinning appears in between hair cycles, and each cycle can take years. In fact, a single hair cycle typically lasts 2 to 7 years. And if you want to learn more about how hair loss happens and how to stop it, make sure to check out the free ebook in the description below. So 2.5 years is on the low end of a single hair cycle. So the first problem with Dr. Ohrenreich's study is that 2.5 years is simply not long enough of a time period to determine whether a hair transplant is permanent or not. Secondly, let's look at graft size. Hair transplants nowadays tend to carry very little tissue. On the other hand, Dr. Ohrenreich transplanted plugs containing dozens of follicular units and a lot of surrounding fat. These grafts are not just transplanting hair follicles, they are transplanting a bunch of surrounding tissue too. So, is there a definitive answer to the donor dominance and recipient dominance debate? This study followed up with 112 transplant patients 4 years after surgery. After 1 year, over 80% of patients saw good growth of transplanted hair, but after 4 years, over 90% of patients saw a reduction in hair volume. Specifically, at the 4-year mark, researchers found 55% of patients had a moderate reduction in hair density, 27% of patients had a slightly reduced hair density, 8% of patients had greatly reduced hair density, and only 8.9% of patients had no change in hair density. This is pretty strong evidence that the tissue immediately surrounding the hair follicles does indeed have an influence on how hair grows. As Joe Rogan tweeted back in 2012, hair transplants are like taking healthy people and moving them to where everyone is dying. This idea fits in with a conclusion drawn from another study that investigated the effects of transplanting hairs from the back of the scalp to the leg. In this study, hairs transplanted to the leg began growing more slowly, mimicking natural growth characteristics of hairs native in the leg area. The study concluded that these results strongly suggest that the recipient site affects some characteristics of transplanted hairs, such as the growth and survival rates. Here we have another study that investigated body-to-scalp hair transplants. It mentions that with regard to body hair transplants, it was observed that the recipient dermis influences the body hair growth rate and hair cycle duration to mimic the growth characteristics of the native recipient site hair. And here we have an interview between hair transplant surgeon Dr. Nilofer Farjo and university lecturer and researcher Dr. Maxim Plikus, two incredibly accomplished people with expertise in this area, and here's what they have to say.
We often get patients 20 years later who come back and they say, oh, well, their hair follicles were very robust and their hair transplant that looked very thick at the time that it was done has now started to thin and doesn't look the same anymore. So do you think there is that happening as well with these hair follicles?
And I think, what you're saying is a really great insight. I think the dogma in hair transplantation was that occipital hair remain testosterone insensitive, even if they are grafted into otherwise testosterone sensitive recipient area. And I think from my reading of hair transplantation literature, for the most part, that remains true, that the epithelial internal papilla cells in the grafted follicles retain the original biology. But as you said, and as I said, hairs are also acquiring local signals from the surrounding cells. And perhaps in the beginning, after transplantation, most of the signals are acquired from the adipose cells that were carried over with the graft. But as years and decades pass, the host tissue becomes more integrated with these hairs. And it's very possible that the host adipose tissue in the frontal skull is also testosterone sensitive and secretes what we can define as negative factors. So over time, you might start seeing those additional kind of inhibitory effects from outside of the hair in the host tissue now affecting the grafted hairs.
So is there any validity to the donor dominance theory? It appears that yes, there is. Dr. Maxim Plikus himself mentioned that transplanted hairs retain their original biology, which might explain why this study found no change in the color, curl, or caliber of transplanted hair. Some other studies have found hairs in different body parts to have different concentrations of androgen receptors. So donor dominance still holds some truth, but the recipient site influence is a major contributing factor, and this is why it's incredibly common for transplanted hairs to start thinning. Unsurprisingly, some hair transplant clinics try to hide the truth. This study claims that references in medical literature may grossly underestimate the prevalence and magnitude of poor growth. This is probably because most hair transplant surgeons are concerned that publication of significant incidents of poor growth would reflect negatively on their practice. So hair transplants is the practice of moving hair from one area to another. But hair transplants don't stop the underlying cause of hair loss. So unless you fix the root cause, a hair transplant is like adding water to a leaky bucket. This is why many hair transplant clinics recommend taking finasteride after a hair transplant to help prevent further hair loss. And if you want to learn more about how hair loss happens and how to stop hair loss, be sure to check out the free ebook in the description below.